So welcome. This webinar is hosted today by Great Plains Quality Innovation Network, which is the Center for Medicare and Medicaid Services Quality Innovation Network, quality improvement organization for North Dakota and South Dakota. My name is Alyssa Wood. I'm a quality improvement advisor for Great Plains Quinn, and we're just excited that you're here today. We are, just a reminder, recording today's session, and it will be posted within 1 to 2 business days on our website at greatplainsquinn.org. There we go. So CMS has directed the Great Plains Quinn to assist organizations in implementing the national class standards. So as part of that work, we've created this space where we've been learning from and with each other about the important interconnected components that impact advancing health equity. Today is the last session of our series, and we're going to dive a little bit deeper into class and the national class standards. And we'll get to hear from 2 organizations who are doing work that aligns with the national class standards. As a reminder, in case you've missed any of the past calls, please visit the Continuing the Conversations webpage, and the recording and resources can be found there. And that link was
I want to just double check. Everybody can hear her, correct? Right? Because I've gotten a comment that someone's having trouble hearing. I'm assuming nod your head if you can hear Alyssa. Okay.
I can hear her.
Okay, great. Sorry, Alyssa. I just wanted to make sure.
Okay. No, I appreciate that. I hate to get too far and people can't hear. So just reminding that the recordings and resources can be found on the Continuing the Conversations webpage. That link was sent out in the reminder email that you got this morning. So if you haven't been there, just look for that link in that email. And just a reminder, throughout the series, we've been compiling a resource document on each of the topics, and that can be found on that webpage as well. So to start out today, I just want to review a little bit more about what class is. And some of these may look familiar if you were on the April call with us, but just to reiterate kind of the definition of class. So class stands for culturally and linguistically appropriate services. So they are services that are respectful and responsive to someone's individual cultural health beliefs and practices, preferred languages, health literacy levels, and communication needs. And class should be employed by all members of an organization, regardless of size, at every point of contact. So again, if you joined us back in April, you'll recognize this slide. I think it's really important to keep the definition of culture and health clear as we work to provide the best services that we can. So Tasha talked about the definition of culture when we talked about cultural humility a couple sessions ago. The Office of Minority Health broadened the definition of culture to really emphasize the fact that every single encounter is a cross-cultural encounter. So the image shows some of the elements within that, the elements of culture within that definition. And I think it's just also important to remember that culture is dynamic. So an individual may identify with multiple cultures over their lifetime. So it's something that it's not a kind of a check mark. We know how this person identifies and it's that way forever. It's very dynamic and something to always check in on and ask. The other image shows the definition of health, which is derived from the World Health Organization. And it reflects on the many aspects of health that influence one's well-being, so including the physical, mental, social, and spiritual well-being. So these definitions are both very broad and all-encompassing, and I think keeping them in mind as you view the population that you serve can help provide some additional awareness of the diversity of that population. And then think about how, with how diverse your population that you serve is, how important it is to really embed class as a framework in your organization. So I know we don't have a lot of strictly healthcare organizations on the call, but just pointing this out, that healthcare governing bodies such as NCQA, Joint Commission, and CMS are including requirements around health equity and providing culture and language appropriate services within their regulations. So class and the national class standards align with many of these regulations that are working to hold organizations accountable in providing that equitable care. So for example, nursing homes are required to provide trauma-informed care and culturally competent care. Larger hospitals right now are required to a commitment to health equity, and the Joint Commission just recently has created a patient safety goal to improve health equity. So the focus on delivering equitable care is here to stay. It's being embedded in these regulations. It's not going away. So thinking about the populations that you serve, class isn't only the right thing to do, but it can help ready your organization to respond to those regulations that are either already present or coming down the pike. So the framework to embed class in your organization is called the National Class Standards. So these standards give your organization those action steps that are needed to provide class. They offer guidance in areas of governance, leadership, and workforce, community language and language assistance, engagement, continuous improvement, and accountability. I'm going to back up one step. Underneath these themes, these are known as the themes, just so you're aware. There are 15 total standards, just to put that number out there so you kind of understand how many action steps that are included in the class standards. I don't think I say that anywhere else. So the Office of Minority Health developed the standards in 2013. So before that, the class has been around for a long time. Before that, there wasn't really any actionable way for organizations to figure out how to operationalize this. And so the standards were developed in 2013 with the purpose of advancing health equity, improving the quality, and helping to eliminate disparities. So although these standards have been around and published for 10 years ago, we've really found in talking with organizations that class and the National Class Standard seems to be a new or unknown concept and framework. So CMS's framework for health equity is structured to align with the HHS initiatives that seek to achieve health equity and reduce disparities among minorities and underserved populations. CMS is using the national standards for class as one department-wide strategy and approach to embed health equity across their programs. So as I stated before, Great Plains Quinn is here to assist organizations in the implementation of the national class standards, as this strategy can also help you and your organizations embed health equity across as well. One really important thing to remember is that class is not a checkbox, or it's not a project with a beginning or an end. Class is, I've heard in one video, I liked the quote that we can't say, oh, we're doing class today. This isn't something that you can do today and then not another day. Class is a way of life and it's a way of thinking. It's a shift for your organization as you adopt these standards. So it is also important to mention that, yes, that the way that the national class standards are going to be implemented at each organization is going to be unique to that organization. So there's not one size fits all. And we are learning along with you as to what resources are a best fit for your organization. And we're here to help identify those resources for you and with you. So today we have the opportunity to hear from two individuals who will be sharing about the work that is being done at their organization that aligns with the national class standards. So I've heard it said several times since just starting the conversation about this topic that organizations are doing some of this work. It's just not labeled as class. It doesn't have that formal label. So a big piece of what I hope you take away from today is that most organizations have already implemented different interventions or activities that would meet some of these 15 standards. And by doing an organizational audit, you could see where your organization is already providing class and then identify those areas of opportunities. So the organizations you're going to hear about today are really seen as forward thinkers and leaders. Sarah Sen and Brooke Sidow graciously agreed to complete the class checklist and are here to share about some of the work that their organizations are doing, like I said, that align with those standards. And you'll hear kind of where their organizations are and their awareness and familiarity with class as well. So today's call is going to be similar to the last session. I shouldn't say the last session, to the session on cultural humility, where I'll pose a question and give them a chance to respond. And if you have any questions along the way, feel free to stick them in the chat. And then there will be time for a Q&A at the end for you to come off mute and ask those questions. So I am going to turn it over to the speakers to introduce them and share a little bit about themselves. And Sarah, do you want to go first?
Sure. I'm Sarah Sen. I'm the Director of Nursing at Richardson Health Center. I've worked at this facility for 5 years. I've been in long-term care and skilled nursing setting for 18 years. We are a 29-bed facility in rural North Dakota, about 20 miles east of Dickinson. Our facility does long-term care, skilled nursing, and adult daycare.
Thank you. And then Brooke, do you want to share a bit about yourself?
Sure, yep. So I'm Brooke Sidow, and I'm the program manager at Huron Regional Medical Center. And I come to healthcare from an education background. So I don't have all those years of experience in patient care. My education is in communication studies and then adult and higher education with some English language training in there and some Spanish training in there. So I have kind of a diverse background, which set me in a good place to get involved with this. But I worked in post-secondary education for quite a while, and then transferred into workforce development and then into healthcare for the past 6 years. So I have been here doing education program development kind of from inception to implementation. And at Huron Regional, we are a 25-bed critical access hospital. You can see on the map there, we're kind of centrally eastern South Dakota located. And we serve about a 7-county radius, which is only totaling about 40,000 people in those 7 counties. So we're pretty rural in nature. And have a lot of really awesome services that the hospital offers. We just redid a birthing center. We have a really nice ICU and dialysis center, and offer some nice services that a lot of rural facilities do not. So a little bit about Huron in the area.
Yeah, thank you. Thank you both. That was going to be my next question. So you guys both tackled both. So I appreciate it. No, it's great. I think it's what's unique and what I'm excited to hear about is the just perspectives from a nursing facility versus a health center facility, and just the different populations that you serve. So thank you both for being on today and for allowing us to learn from you. I really appreciate it. Okay, a bit before we get into the questions for Sarah and Brooke, I shared that they both completed the class checklist, just so you know what that is. So CMS created an implementation checklist for the national class standards, which is intended to act as an organizational audit or a gap analysis to help you identify what you're currently implementing and those areas of opportunity. So Great Plains Quinn does have an electronic version of this checklist, which you can see the link is there at the bottom of the screen. I'll just point out on our webpage where that is at the end here as well. So please know that this is truly just a tool or a guide for you to use. There's nothing that is binding you to those answers by filling out that checklist. I know class with the 15 standards can feel overwhelming, and then when you hit submit on something can also feel like you're stuck to something. So this is just the reason we have it electronic, is that if you did want assistance from our staff, that we have a version of that checklist as well. And so we're looking at the same answers and document that you've completed. So just know that it is there for you to utilize if you're interested in taking the step to do that audit. On the right hand of the screen, just pointing out that this is it's called the blueprint. It's a very large but helpful document. It provides additional information about each of the standards along with those implementation examples. Sometimes it's helpful to use that as you're filling out the checklist if you don't quite know if what you're doing fits. So that can be helpful. So, okay. Now I know this is more than one question, but I think it will help us understand kind of where your organization is with class and the national class standards. So I'll leave it up to you two, whoever wants to go first. Can you share with us how you learned about class, where your organization is with class, and maybe about your approach to completing the checklist?
Sure, I can hop in there. We have been doing a lot of organizational structure. We've had some new leadership, and we have looked at different policies in a lot of different ways. I do a lot of grant writing, and so I've stumbled across the acronym class, but I didn't dig into it too far. And then we were just kind of talking about some policy implementing. And then when Alyssa and Katie approached us, then we're like, oh, so this is kind of like what we're doing. And we sat down with our administration and talked a little bit about what we were doing and if this was something we wanted to dive more into. And absolutely. So we went through the checklist together and discovered that, like what Alyssa said earlier, much of what we were doing aligns with the class standards. We just never actually labeled it that. So we started approaching that a little differently and looking at some of those standards as an alignment for us to build policy and to be able to get on the same page and use the same kind of language.
Thanks, Brooke.
For our facility, we learned about class. Well, as we all know, long-term care and skilled nursing, we have guidelines by CMS and regulations for culturally competent care. During COVID, we ended up actually getting quite a few applications for residents of a different culture or a different language. And we could provide them care, but we weren't able to effectively and appropriately communicate with them. So that's when I started looking into that. My search with class actually started off with the thinkculturalhealth.hhs.gov. And that's where I started learning about it and digging more into it. And as Brooks said, a lot of the areas, it's just connecting a lot of the dots because you already have a lot of stuff in place with regulation, and it's just relabeling it and modifying it.
Cool. Thanks, Sarah. Okay, next question. So Sarah, I'm going to pick on you first on this one. So when you completed the checklist, you have several interventions that you plan to implement, and then you highlighted these 3 in the action plan section. Can you maybe just share with us the work that you're doing in those areas, those different interventions that you, like you said, since having that kind of aha, we need something around this to enable us to communicate with these different languages. Share with us those different interventions in those areas and maybe what motivated you to get that started. And maybe you already spoke to that in that other piece, but that's okay.
So a big motivation to get it started for us was being able to accept more diverse populations, not only as residents, but as staff. So mostly our nursing department was, and social service department was more of where we focus more on cultural competence, where it actually takes your entire organization and governance body. And so we did a lot of education with all of our staff on class and communication and different cultures and health equity to get this up and going in our facility. It can't just be one department. It has to be a facility-wide thing. And we did education with cultural competent care and linguistically appropriate services and policies. And then we do an assessment upon admission for the residents, and not only them, but their family that may not be of our culture, to learn about them and learn their language. We also implemented, after the assessment, we did implemented a program called UCare Lingo, and that actually has translates into your 35 ADLs into 17 different languages spoken, and it has visual, audio, and written text to assist with reinforcing conversations so people understand it. It also has the speech-to-speech option that translates the conversations between the caregiver and the patient to text and audio. So it also is applicable for the hearing impaired. And so we've done a lot of that in our facility, especially, we have people that speak Russian, we have people that speak German, and it depends on the day whether they want to use English or a foreign language. So we've been able to utilize that. We've also utilized that with people that are hearing impaired in our facility that have a difficult time communicating with staff. So like I said, it's not just a cultural or language. There's a lot of other things that it's been falling into, and we've just realized it over time and adjusted our policies to fit that.
Great. Thank you, Sarah. I just think it's cool how you're responding to the need, right? And not because it's strictly regulation. We're responding to the need. That's the best
Right.
part. Okay. And then just so everyone's aware, these are the 3 standards. I just have these up. If you're interested in how the standard reads, I'm just going to have those up in the background as they share. So if you have questions, throw them in the chat for our speakers and we can answer those at the end. I'm going to shift over to Brooke's question. So Brooke, at Huron Medical, you've been working towards providing culturally responsive care for some time as well. In your checklist, you noted several standards that's currently being implemented, and like I have 3 slides worth of currently implemented standards here. So feel free to speak to whatever. Just kind of like I said before, have them up as a reference point for individuals to read in the background. So can you share with us kind of the evolution of this work and what motivated it in getting started?
Sure, absolutely. So I'm not sure if everybody knows the diversity of Huron, but we were a first stop immigration for refugees from Thailand, Burma, Myanmar, and all of Karen descent for the most part. And that was about 10 years ago or so. And then we became a refugee stop for some Hispanic communities as well and countries as well. So there are a very large amount of countries represented in our small community of about 14,000 people. And when they started to come, they did not speak English. They did not understand English, couldn't read their own language. So not only were they unable to communicate in English, but also were illiterate in their own language. Many of them came from jungles and from refugee camps and were just fleeing to America. So we became a welcoming spot for them with the help of some really awesome people in the community. The school district came in, the healthcare sector came in, some businesses came in, and we just all said, what are we going to do to welcome these people? We had some elders to work with that had a little bit of English, and so we worked through them, utilized a lot of the translation services that are out there, and of course have come a long way in the last decade. But Language Line and some of those typical kinds of translation softwares and live people on the background there. And so we started just jumping all in and trying so many different things. Some things worked, some things didn't, and then we just tried again. I would say is one of our strong points maybe is just that we're persistent and keep trying. And it's kind of been a personal mission of mine. Like I said, I have that language background. I've lived in other countries where I didn't speak their language as my first language, and it's hard and it's scary. And so trying to help welcome the population, and especially when you need to seek healthcare, is one of those areas that has become a passion of mine. One of the goals of our healthcare facility is to have our workforce reflect our community's population and make that look very similar. So we have strived really hard to recruit and make pathways for workforce to become healthcare workers in any form. That could be entry level and that could be all the way up to physicians. So we are working diligently on that. That's been kind of my mission to make these pathways into healthcare. So like I mentioned, entry level, we have lots of partnerships put in place. We work closely with the Department of Labor and Regulation. We've built apprenticeships to do hands-on paid training. We start that as early as a CNA, and that can be a youth program for high school students. And then we have pathways, like I mentioned, to step into further along the way. So we have nursing apprenticeships, we have surge tech, medical assisting, and we just recently have partnered with SCSU to do respiratory therapy, and also we are embarking on IT for apprenticeships. All of these avenues have given us access to the diverse populations and making those partnerships. So our leadership is really supportive of it here at HRMC. Like I said, it was kind of a community effort. We created a task force to really help us figure out how we are going to embed the population. That was one of my missions, integrate our population into our workforce. And so we've been working really hard doing that and making these different pathways, like I've mentioned before. And I'm really excited to mention that we actually will be graduating both Karen and Hispanic nurses this coming year. So we are really excited. Of course, we have CNAs and some entry-level positions, but now we'll actually have some nurses that are these refugee populations. So we're pretty excited about that. That's kind of really focusing on that class standard 3. And also I would say with the 5th standard as well. I don't know if you guys can see it on your screen. My screen is frozen. So so it's just blank up there right now, but the language assistance, of course, those communication pieces are a huge part. And not only for the patient side, but also for our workforce. So we have went to the bat, I think, to try to get these education programs. If you're familiar with the TEAS test, which is an entry-level exam for nurses, and that test is only given in English, and it's a timed test. And we have a large number of Karen and Hispanic individuals who really would like to get into nursing, and they're frankly scared of the test because it's timed and they're translating everything in their head, trying to get it out on paper, and they just run out of time. So we've made several attempts at doing TEAS prep courses, and really helping with that language piece and paying for that for our staff, our entry-level staff who want to move on further into nursing. So that's been one of the really big pieces there that we've worked toward. But of course, like the signage and all of the policies and things like that, we have translated. Kind of a fun story, back before we had anybody that could type Karen, we had just these handwritten signs all over everywhere, and we tried to talk about birthing and, you know, all of these handwritten symbol signs that were posted all over. So we, like I said, have walked through the steps to try to help both our population and our workforce kind of integrate that together. Clearly working a lot more closely with language than some of the other areas of class, but that's been a really big push for us, and a lot of what our work has revolved around. And that just lends itself naturally to be building those policies. And we've kind of had unidentified people that are our champions, and trying to work that into HR and through administration and embarking that across the whole directors. One of the most recent things that we've done at HRMC is participate in the South Dakota CHW program, and we have hired both Karen and a Hispanic CHW in our facility, and they of course are bilingual, and they can actually go out into the community, and they go to churches, they go to parks, they go to restaurants, you know, and hang out, and have just become that source of information and a resource to bring or help bridge that gap to healthcare for some of our individuals who still may not speak the language and still may not have matriculated into more mainstream healthcare. So that's kind of been our big, most recent push, was getting these individuals to actually go out into the communities and then come back into the healthcare setting. I think I'll stop there, and then we can move on.
That's really great. I think I'm just going to point out one in one of the resources that I've listened to, they talked about, you know, when you're getting started, you know, thinking about when you're advertising for that job, and are you putting it in the paper in those multiple languages? Are you putting it, you know, is the job description written at a literacy level for people to understand it and read it? So I think, yeah, the workforce effort is amazing at all of the work that you guys have done. And I think when we talked, this has been years and years of work that has been pouring into this. So it's really cool. Also just responding to the need again, and not because of the regulations, right? So doing what you need for your population. Okay, I'm going to jump a couple slides. So I had these up in case we needed to reference them, but these are the other standards. I think there was one I wanted to point out about, I think it may be over here, a class standard 13, partnering with the community to really design and implement. Kind of that speaks to your task force work, right? So just a lot of really cool partnerships that have been born through that work. It's really inspiring and awesome to hear. Okay, I think this is the last question I have. So as you kind of are going down this journey or path, and you're both at different places, right, with this type of work, but definitely entering the work because of the needs of your communities, what would one piece of advice that you would give somebody who's just getting started, or maybe it's not quite on their radar yet, and just dabbling in class in this piece?
I would say that you definitely just look at the needs of your community. In the Richardson area, we do have some Hispanic and Filipino families, but also trying to bridge that gap and the barriers that cause ineffective communication with diverse cultures, to where they don't understand, finding tools that you can use. That's probably one of the more important things, is really focusing on what your needs are for your facility and your community, and where to find the resources.
Yep, I would echo that as well. Bridging the gap is a huge piece. For us, we had to jump in right away for some of those things like how do we serve for kind of the preventative healthcare, the routine healthcare, and then the emergency situations. All are a little different, but finding that area of how to communicate with your populations is very much key. And for us, it was bridging how are we going to help again, have a workforce that really can speak to these populations because you know how I mean, even if you have a face-to-face translator, for example, some of our new populations that are coming in from the Hispanic cultures are they're from the mountains in Guatemala, and they have very different dialect or different ways of speaking than traditional Spanish. So we have an OB that speaks Spanish, but can't communicate with some of these new moms that are coming in. And so our CHW has really helped to be that bridge. And help build that gap there and taking the time to explain. So that's been really, really important. I'd say identifying those gaps, bridging, helping to bridge those gaps. But probably the most or the best piece of advice I can give is being persistent. If you have an idea and it doesn't work, try again. We've been doing this for about 10 years, so it has been very much been a learning curve. You try something, if it doesn't work, use that to make you stronger and try harder the next time. So that's kind of been our key, is just being persistent and looking for those areas in which we can and are able to help.
Awesome. Thank you both for sharing. That's great. I think one thing we all know for sure is that a lot of organizations in North Dakota and South Dakota are doing a lot of really great things. So that's the one thing I would say that the class framework does offer. It offers, an area to really capture what those things are, and then allows that ability to improve upon them, and allows for that persistence, right? To learn from what worked, what didn't work, and what can we do better, and overall just provide that better care. So cool. And I think I have down here, class is a journey, right? It's a life, like Sarah said, they've been at it for 10 years. Some people are just getting started, and it's something that's just ongoing and with us all the time. So with that, I just want to thank you so much for being here and sharing with us what your organizations are doing today. This is super helpful just to kind of hear these examples. And I will just want to open it up for questions, or if there's anything we need to address in the chat. I do see one thing. It says, what is the language line called again? I think that was to Sarah, the app that you're using.
So the app we use is UCare Lingo. It's directed more towards home and long-term care. So it has all of your ADLs in there. It has all of the COVID questionnaires in there. It has, like I said, the speech-to-speech, and it's in 17 different languages. So it's really nice. And it's nice that it also translated into a written text in their language. So that way they can visualize it. It helps with communication. So.
Thank you. Any other questions? Does anybody want to come off mute? Feel free to, or come on camera. You're comfortable.
I just put the link. Hopefully I got the right one in there. ucarelingo.com. That looks right. Sarah?
Yep.
Yeah, it is.
Yes, that's correct.
Okay, good.
I have a question for Brooke. This is Katie. I know we had talked and stuff, and you had mentioned about the workforce. When they first came in, as refugees, obviously they wanted to work. That just keeps things moving, obviously. But how did your community come together as a workforce in some different arenas, that allowed that and worked with you? And also, did they embrace it? I'm sure not everything is, rainbows and unicorns, so was there a lot of pushback too? So a two-part question,
Yep.
Sorry.
Yeah, that's okay. Yes, there was some pushback in the beginning. It was scary. There was a lot of misconception and stereotypes that we had to demystify and to kind of break down there. Certainly, as I mentioned, our stakeholders came together. We talked about the partners. Our education sector was huge. We knew that we would have a lot of children coming in that would need to be absorbed into the school system. So we started with certifying our teachers and getting them at least an ESL endorsement, or getting a paraprofessional that could help with each of the classes. So that was a really great, strong piece from education. A lot of our plants in the Huron area were willing to take on shifts that would be predominantly in a language. So then we could bring in workforce that was happy to do shift work, working in some of those major plants in the area so they could start working. We had to have a place for them to start, right? Not everybody can hop into healthcare right away, so that's pretty difficult, or education for that matter. Cornerstone's Career Learning Center, if you guys are familiar with that, CCLC has been a very strong partner for us. We have always offered ESL courses, but we worked through some grant work and got additional funding to be able to offer additional classes, night classes, weekend classes, day classes, brought in more instructors to be able to help with that so that we could start communicating those basic pieces. From the beginning, it was very education driven. So even bringing the postal company in and bringing the electrical companies or the power companies in to talk about what you can and can't do kind of things and showing pictures. Our very first attempt diving in for an education piece was an intro to healthcare course for English language learners through that partnership with CCLC. So we would bring groups of people to the hospital and show them what an X-ray machine was, what a patient room was, show them a bill and kind of go through those things so that there were those pieces of communication. So that was kind of the beginning part that helped bridge the gap. So we had people that were in positions that, that were in traditional kind of shift work type places that they didn't really have to speak the language. And then through all of these steps have tried to work toward placing more specified positions or workforce. So that's been a journey. And I cannot remember now if I have addressed both of your questions, but if not, I'm happy to rework those.
You sure did. And Huron's really done a lot of things. And I think for class, we have to understand it's not just healthcare, it's in all entities. It touches everyone in the community at every different level, every different aspect. So, acknowledging the group effort made by Huron, that's something to be very proud of.
Yeah, and that's exactly it. Just a strong partnership and a group effort from across the community has been really important in making it, I'm going to call it successful. I think at this point, we've been pretty successful, still have a lot to learn and still working toward that. And I don't think anybody's asked it yet, but if you are like I was and you see the class standards, it looks scary because it's formal and its standards and there's many pages of it. And then once we started looking through it and going together as a team, it was like, oh, we're doing this already. So it wasn't quite as scary. So if you're kind of intimidated by the class standard language, just dig in a little. It's not as scary as it seems, but.
That's great. Thanks, Brooke. And I see, is it Nadine that has a question on the email, the link class standards? Yes, I will bring that up here in a minute and make sure you have the link for sure. Yeah, I really appreciate you saying that. I feel like I say that doesn't quite hold as much clout as somebody who's taken it on the receiving end. So I appreciate that. Any other questions?
My question is for Sarah. I was just curious what feedback you get from your residents. When you come to them with an app and you're trying to communicate to them with an app, I guess. And I'm assuming, your residents are a little bit older, so that technology might be something new to them, but just curious on how they respond to that.
So you would be surprised. We have one resident that she speaks English and Russian. Her English is a little bit broken, but she does very well at it. But a big thing we had is she always wanted assistance translating for communicating with her family in the Ukraine and in Russia. And so she was always asking staff, could you type this out for me? Could you type this out for me? Well, a letter A in American or English is not the same as a letter A in Ukrainian. So our staff was really struggling. So that app also assists with that because you can say what she wants and then it prints it out in her language so you can see it and just type it in for her to communicate over Messenger with her friends. We have a resident that is hearing impaired, and it's also very helpful for him to have a visual because the staff don't always understand him. Even though he can read lips, he doesn't use sign language, but he can read lips, and we just don't understand what he's saying all the time. So having that in a text for him to see what we're actually saying versus what he thinks we're saying, and then him to be able to type back what he wants is very helpful. Like I said, it's not just the foreign languages, it's hearing impaired as well that it helps with. So
Any resistance at all, Sarah, that you've come across?
We have tried using the iPad for one of our residents that had a stroke, and he has aphasia, and he's not a big fan of it. There's a little bit of pushback. He looks at it and he sees it sitting there and he knows that it would be easier for us to communicate, but he's very set in his ways and would just rather walk somebody down to the stock room to get him a tube of toothpaste than to show us his needs on the app. So
sure. Interesting. Yeah. Any other questions? Okay, I'm going to keep going on the slides here, but if there are questions, throw them in chat or just come off mute and interrupt me at any point. I'm just going to keep rolling here. So just want to let you guys all know that GPQuinn, like I've said several times, we are here to support with technical assistance around class and the class checklist. We really do encourage you to check out the class checklist or that audit. Like Brooke said, it's not quite as intimidating as it may come across. It is just, there are 15 standards. There are a lot of them. But it's really helpful to see where your current or your organization currently is. And then our team is here, like I said, to provide that on-demand technical assistance, whatever's right for you guys. So you can see our team members and their contact information here. In South Dakota, we have Katie Burkett and Stephanie Hansen. In North Dakota, there's Lisa Thorpe. And then really you can contact anybody at the Great Plains Quinn and we can get you into the right hands. So reach out directly to us, or on that class checklist at the very bottom, there is a checkbox for if you would like to connect with a Great Plains Quinn person. You can just check that and we can reach out to you. So I'm going to take 1 minute here just to show the Great Plains Quinn website and where our resources are that I've been talking about, where these links are living. So greatplainsquinn.org, if you hover over initiatives and go to health equity, it will take you to this page right here. I'm going to refresh it real quick. And so you can see the continuing the conversation pages here. That's the series that we're on. All of the recordings and everything is there for that. Right below that is the class checklist. So you can click this to begin the class checklist. And if I scroll a little bit further down, all of these accordions open up and they have resources underneath them. For the national class standards, we have an accordion for that. And you can see a bunch of resources here. Think Cultural Health is what Sarah touched on earlier, is kind of where she started digging in. That is the HHS, I have it open right here, HHS landing page for class. There is a lot of information out here. There's education, and a lot of this education does have continuing education hours and different things available there. And there's like setting or profession specific, which is really helpful. I'm also going to highlight, so Great Plains Quinn is, we've been pulling information out of that blueprint. Like I said, it is just a large document that can feel overwhelming. So we've been pulling information one standard at a time and sticking it in our blog posts. And that is being housed here. So you can kind of, if you just want to dive into one standard, you know, I want to focus on this, or this is what we're focusing on. These are here, and they're just different, just pulling that information from the blueprint to put it right in front of you. For the strategies for achievement, the blueprint link is here. So you can click on that we pulled out. And then we have a video or a Powtoon, depending on how you like to take your information in. You can click on that and hear similar information on that, however you like to share information, I should say too.
Alyssa, can I just add, we're just launching those 1 week at a time. So on our news post, if you are a member of the Great Plains Quinn email list, every Tuesday at 2, we send a series of news related stories, and we're sending one class standard a week. So on this page, the accordion that Alyssa just showed you, we're only to standard 8 because we've only released standard 8 in a news post, if that makes sense. But we'll continue to populate this page and maybe come up with a way to condense it to make it a little bit more user-friendly once we've got all 15 standards added. But you can go to our news page if you want and search by class in that little magnifying glass over to the side to search. And you could pull up anything related to this topic in that search bar. So if you typed in class, thank you, Alyssa.
Mm-hmm.
Yeah, so we have every one of the standards in a blog post along with, you know, obviously posts related to this series, but anyway, thank you, Alyssa.
Yep, I'm just going to go back a little bit further. You can kind of see, if you go back a little bit for this, kind of that intro knowledge into class, and it talks about the checklists and the standards and whatnot there. And I know, is it Nadine asked about the link to the class standards, that there is a link right here. We kind of have them all. We have these links in multiple places, hoping to make it easier for you guys to find. So it's on it just takes you to that Think Cultural Health page with those standards. So I will stick that in the chat right now, Nadine, so you have that. But just wanted to also make sure people knew that these resources are here for you to access at any point. And there are a ton. Class is not new. There is a ton of resources out there about class. So if you're like stumbling or don't know where to look or where to go, that is what we are here for. We can kind of help bubble up the resources that make sense for your organization. So just please reach out and ask.
Alyssa, do you want to go back to the Health Equity Continuing the Conversation series page?
Sure.
And just remind individuals that every recording and presentation that we've hosted over these now 7 sessions, 6 as part of the series, and then our intro session in April, are all here. And then if you go up a little bit, Alyssa, that resource document right there, that document includes every resource that we've referenced throughout this entire series. So, including obviously today. So if that is helpful, worth mentioning maybe.
Yeah, thanks, Carrie. Okay, any questions on our webpage or resources or anything there? Yep. Okay. Well, that kind of brings us to the end of our session in our series. I'm gonna just bop over here. We always like feedback. It's super important to us and to our speakers, just so we know. And like I said, this is the last session of our series. And so if there's anything that we can do or make that helps you guys in any way, as tools, resources, education, connections, anything like that, let us know. And we're happy to you know, find the right partners and make it happen for you. So feedback is always valuable. We really appreciate it. And then last but not least, stay connected, right? So this is our last time together. I'm just going to highlight, we have our podcast series, which is meant for kind of the community members. So use those if you have any sort of education forum for community people. Those are available. Connect with our QI advisors. That's really anybody here at that Great Plains Quinn team. And then lastly, the Community Coalition Listserv. This is a place for us to stay connected and to continue to learn together and support each other. It is a two-way listserv. It's not something that's information is just being pushed. You can pose a question and get information there as well from each other. So not just the Great Plains Quinn staff, but it's meant to be more of a communication portal. So use that as you start launching into this journey with class. And thank you. So just thank you for attending today. Thank you for attending the series. This has been wonderful. I think everybody has been very open and engaging throughout the series. We really appreciate that. And just thank you to our speakers today. And I've been really grateful for this time and just look forward to connecting and continuing learning together in the future. So, and you get 10 minutes back in your day. Unless I'm going to pause. Any other questions from anybody or want to talk about anything from the series, not just maybe this topic?
Just a lot of thank yous coming in through the chat.
Great. Cool. Very cool. Well, thank you again, Brooke and Sarah, and thank you everybody for attending, and have a good day.
Thank you.